Good afternoon. I'm here with Dr. Demetria Lindsay, who is our Public Health Director for the City of Norfolk and the City of Virginia Beach for the Virginia Department of Health. So thank you, Dr. Lindsay. I know your schedule is incredibly busy right now, so I really appreciate you spending a few minutes to talk about what it is you do. Can you tell us a little bit more about your background and how you came into this position?
Well, it was not how I started. Let me say first, it's a pleasure to be here and thank you for this opportunity. I appreciate that very much. Um, I did not start out in my training to go into public health. I was very interested in becoming a physician. So I was trained as a primary care physician. I went to Clark Atlanta University, some people may have heard of it, for undergraduate school, and then Duke University for medical school training. And my interest was in primary care and working very closely with my patients, educating them about the importance of taking ownership of their health and how they could maintain a healthy life. After working with people for a while, I realized there was so much more to being able to be healthy than what happened in my office. A lot of it had to do with what went on in their day-to-day lives. And I gradually kind of moved into public health from there. I worked for the state for a while at the state level in another state, and eventually came to Virginia because I wanted to be involved in local public health and work directly with communities on health improvement. So I've been here since 2002.
Well, I can tell that you have such great, what they call it, bedside manner. That as a physician, working with patients, I could see. I bet you're really good at that as well. So, it's very easy to work with you. But you've got a lot on your plate right now, and people are talking about public health in a way that I don't think in my lifetime I've ever remembered talking about this. With this pandemic right now, can you talk a little bit about how testing is going in the city of Norfolk? What is the role of the public health department versus working with whether it's hospitals or various physician centers?
So I think most people listening to this are aware that on a national and local level, there have been lots of challenges with trying to scale up, our capacity to do testing. And that has created challenges for us entering into this unplanned, uncharted territory that we're in right now. And a lot of work has been going on in trying to increase the access to testing and our capacity to do it. I think we are beginning to get there. We're not where we want to be yet, but there have been some dramatic improvements, particularly in the past month and the past few weeks. There's a lot of effort going on locally and at the state level. The state level, under the governor's leadership and the State Department of Health, we have a number of task force with community participation involved in looking at how we can increase access to testing. So our resources have dramatically improved, and there's a lot of effort to encourage private physicians to start doing more testing, as well as the access through hospitals and private labs. And we have a number of private businesses, such as our pharmacies, that are also coming on board and offering testing. Our urgent cares initially didn't have that access, and now that we have more resources with our testing kits and our swabs that were a problem for a while that you collect the specimen with, they're able to offer testing as well. Now, since I'm over at Virginia Beach and Norfolk, I do kind of get an opportunity to see what resources we have. And we haven't had as many places offering testing broadly to the community in Norfolk as I would like to see. But I think that's also getting better.
What can we do to help with that?
I I think some of it may be just reaching out to different companies or resources and encouraging it. The efforts to bring physicians online, I think, is very active right now. Our health department has been partnering with Centera to offer testing in various places. And in addition to the need to test broadly, we're very much focused on looking at where people may not have access.
Mm-hmm.
So we've had lots of tests done, even though we may not have a lot of sites offering. Many people have insurance. They can go to the emergency room or they can work with a private doctor to get testing. But we have people who are uninsured, who may not have a home, who may not have good transportation, who have a greater need for help in that area. So we've partnered with Centera Hospital, actually Centera Ambulatory Care, to go out into neighborhoods and offer testing. And we're working on doing more of that.
Great.
We've also offered testing to the homeless population at Union Mission. We want to also offer it through the through our CSB as well. And we've also offered for elderly through one of our senior living facilities. So that's kind of looking at those who may not have access, those who may be also at increased risk through either age or health conditions that may place them at risk. And another one that I did mention was maybe employment, people who are constantly facing the public who may have a higher risk for exposure. So those are the areas we want to focus on, but at the same time, we're looking at reaching out to facilities that we think may have the opportunity to do testing to see if we can help facilitate that process of coming on board.
Okay, so a couple of questions from that. Number one, if somebody were watching this and they don't have insurance, how would they find out about testing? Is it free? How does that work? Would they call the Department of Health? What's a good place for them to start?
They can call the health department, and we will make them aware of locations through our call center that they can access testing. Also stay tuned to public information, because we are planning now to offer some broad level testing in the community, as well as focused areas in the community for those with limited access.
That's great.
So we will be just kind of rotating those opportunities around to ensure that people do have an opportunity to be tested. And we're also broadening the criteria for testing. If someone feels they have symptoms, they're very much encouraged to get tested. But we will also be offering it to people who may be asymptomatic, but also want to know if they may be infected.
Will you be offering antibody testing or just COVID-specific current COVID case types of testing?
For the most part, it will be what we call the PCR test, which is the gold standard test for COVID-19 active infection.
Okay.
We have, to a limited degree, also alongside that, when we work with Centera, occasionally provided an opportunity for the antibody testing, but it is in kind of early stages, so it's not what I would recommend right now for making assumptions or interpretation of what's going on.
Right. So also, if there is an organization, a business, a church that wants to offer this to its employees or to its members, would they similarly contact the health department to find out how to do that?
They can contact the health department, yes, and we'll be happy to talk to them.
Great. Maybe somebody's watching this and will want to take that on. That's awesome. Okay, so next question. What is contact tracing?
Big word. We've been hearing a lot about it on a national level. And contact tracing basically is working with someone who may be infected And through through an interview, and that may be several interviews, working to identify who they may have come in close contact with or exposed, potentially exposed to the infection, based on the history of when we know they may have had an infectious period, and their activities. So contact tracing is really part of a broader spectrum of what we do or have been doing for many years in terms of our efforts to control infections, or what we call communicable diseases, infections that may be passed from one person to another. And it really starts with, I started to say it starts with our case investigation, but backing way up, we have a lot of surveillance activity that we do in the city. We have required reporting of certain conditions from physicians, labs, and hospitals. And those come into our epidemiologists on a daily basis. Our epidemiologists are also sometimes called disease detectives, and they get these reports and they review them, and they may generally talk to the individuals who had the positive test and try to get an understanding, either based on the labs and also reports from the hospital, as to whether this is a communicable disease of concern. Then if it is, we interview that individual to understand that information, talk about their illness, when their symptoms started, what they were doing during that period of time that we know this particular disease would have been infectious to others. And then we go from there to identifying who may have come in close contact with them, and reaching out and identifying those individuals, determining whether or not they need to be tested. And if they're positive, it goes on from there to identifying their contact.
Just sort of spider webs out.
Yes.
So if you get a phone call saying, your friend John Smith has tested positive and you were with him for 30 minutes 2 days ago, is the question, what's the question? Do you have symptoms? Would somebody have to quarantine at that point? What does that look like?
So first of all, we would not call you and say your friend John Smith tested positive. We would say that we're reaching out to you, and we make sure that they had ideally already been informed of the infection by their private physician, or whoever was the physician who had them tested, or a clinician, because we don't want to hit them cold if at all possible. And hopefully they were informed that they would be hearing from us. Okay. Then when we reach out, we are saying that we have information that you tested positive for X infection. And sometimes that may mean talking to them about what that infection is and what it means. And then we start asking them questions about their symptoms and when they started. Mm-hmm. So we're looking to determine what was that period of time when they may have been infectious. Then it's a series of questions about what they did during that period of time. It might be, where do you work? What do you do for, after hours? What kind of hobbies do you have? Different questions to just sort of get a sense of what has been going on in their lives during that period of time. Generally open-ended, and then we sort of listen for those little key flags to follow that trail to identify people.
And so would the health department then take that next step of contacting whomever's on that list? And
yes.
What I heard you say is we're not going to say John Smith sent us, because of health safety and security and privacy laws. I suppose you can't actually say that.
So we're very careful to try to ensure confidentiality of an individual's health information. So they may have they've come in contact with a number of people, and we're very careful not to identify to them a particular name we're asking for information from them.
That's really
Try to
important.
be diplomatic about that. And, you
Yeah.
know, sometimes it may mean reminding them that we will give you the same courtesy of keeping your information private as well.
That's, I mean, I hadn't even thought through that, but that's, you know, it makes all the sense. We want people to feel comfortable being tested, and it's important that they know that. If somebody does test positive, what's the step from there? I mean, is it we hear 2-week quarantine. What does a quarantine mean? Can you be in the same household with your family? What does that
So
mean?
that's an important part of that. And I should have talked about that as well, that, you know, one of the first things we want to do is make sure if they're infectious, that they have separated themselves from others so that they're not putting other people at risk. So we do have to talk about that piece as well. Um, for for this infection, we're looking for about 2 days prior to the onset of their symptoms, and then out about at least 72 hours past the resolution of their symptoms. So, so we're looking for that window of time. And generally, I guess I should add that once we give them, talk about instructions for how they should separate themselves off, then we try to periodically check in with them to make sure that everything's going okay,
Mhm.
and that they are what we call isolating themselves. So we've got 2 types of separation. One is isolation, and that's the person who's infected. So we want them to maintain themselves apart from others as much as possible. Definitely not go to work or go to school, or as much as possible go out in public. Within the household, for the people who are at greatest risk, we try to explore whether or not they can separate themselves off into a separate bedroom with a bathroom if possible.
Mhm.
And if that's not possible, we talk about other ways of kind of reducing the risk. And we've also been taking out kits to help people with taking their temperatures and monitoring their symptoms, knowing what to do if they develop problems, how to call 911 or call their physician ahead of time before showing up somewhere.
Mhm.
And then we also talk about who else is in the household, because they're that first level of potential exposure, and what they need to do to quarantine themselves. So we have isolation, and then we have quarantine, someone who's not symptomatic, but they need to do to separate off as well.
Okay. A lot to think about. That's a lot of contact tracers to accomplish all that. Would the state said they were going to try and attempt to hire 1,000?
Yes, currently we have been operating with our current staff, and also we have Medical Reserve Corps volunteers that may help us, and a few contractors. But I think it's important for people to realize that this is something that we've been doing for many years. So it's not a new process for us. It may be that the volume could increase and place more demands. We do this for tuberculosis. We have had active cases and continue to have active cases. In addition to for TB, we also have people that go out and observe those individuals taking their medication to make sure that they're compliant and they're keeping people safe.
Hmm.
We do it for other outbreaks. You know, we've had restaurant outbreaks you hear about in the media, and other infections. We have these types of communicable disease issues all the time. Sexually transmitted infections are another area that we do a lot of very active contact tracing as well.
Well, certainly we've all learned a lot more about public health in the last few
Yes.
months. That's for sure. So now we're starting to reopen. We're in phase 1, and we are wearing masks when we're in public enclosed spaces.
Right.
What could you just give us? I think people should know by now, but what's the purpose of a mask when we're talking about cloth masks and being out and around people? Are they going to
So
keep us from getting sick, or are they going to Who does it really protect?
It offers the greatest protection for people that the wearer encounters as opposed to the wearer themselves. It may offer some limited protection to that individual as well, but for the most part, if I'm infected and I wear a mask, I'm protecting you from possibly being exposed to me. And the primary, from everything we're seeing with coronavirus, this new coronavirus, the primary means of infecting others is through droplets.
Mm-hmm.
So when we cough or when we speak, and to some extent even when we breathe, we emit droplets from into the air. And those droplets can land on someone else and they become infected, particularly if they gain access to the mucous membranes, the mouth, the nose, or we have them on our hands if we touch our eyes. So that mask is much more effective in holding those droplets in and keeping us from emitting them to and infecting other people.
So if you wear a mask and your nose is still showing, is it as effective? Because I see a lot of people doing that, right? It has to be the whole, okay.
It needs to be the nose and the mouth. It should fit snugly around the nose and around the face and under the chin.
And I've seen some people wear the clear shield, but without a mask underneath. Is that effective?
It can definitely help. I don't know that I can give you a percentage,
right?
But I would think it would be more effective to also wear the mask underneath that. Right. You are also protecting the eyes if
with the clear shield. Sure.
Yeah.
Sometimes I just wear my sunglasses and a mask in the grocery store, and I look really dorky. But
well, everybody else probably feels the same way. So
who knew that? Mask chic, like having everybody has their own style with masks now. Mine's just boring beige. But what color is your mask, Dr. Lindsay?
I have a variety of colors.
Oh, you do? Do you match your outfits?
No, I don't try to do that. Just make sure that I have one that is clean and I can rotate out.
There you go.
So that's the main thing.
You do have to clean your masks, I guess.
Yes, you should. And theoretically, if you are using that mask to block droplets out, you should consider that outside to be contaminated. So you need to be very careful with how you take it on and put it off. Use the strings to remove it. And also what you do when you're wearing it. One major concern I have when people are wearing masks is they may develop a sense of false security and they do things that they're not necessarily aware of. So you'll see a lot of adjusting of the mask, touching it, and they may also rub their eyes. They may pull it down and wear it under the chin for a while or wear it off one ear, all kinds of different things. And all of those pose potential risks for contaminating yourself.
Wow.
It's also very important when you remove the mask that you either wash your hands or use hand sanitizer so that if you contaminated your hands are free of germs and you don't infect yourself accidentally. So very important. If you're going to wear a mask, you need to wear it safely.
I've learned a lot. I only have one mask, so now I need to get multiple masks. I need to be careful how I touch the outside of the mask. I need to wash my hands. Yeah.
The strings.
Yeah.
And if you're going to reuse it, you want to make sure you secure it maybe in a paper bag or something else, and that you're going to use you're going to put the correct side back on. But ideally, since we're talking mostly about cloth masks, you can wash those, and it would be good to have enough that you can rotate them, wash it, and use another one the next day.
There's just so much to think about. This has been really helpful and weirdly fun to talk about public health. And I just want to say thank you on behalf of all the citizens in Norfolk and the region, since you work at both Virginia Beach and Norfolk, for all that you and your team are doing. I know you're working incredible hours, and we really appreciate the sacrifice that you have made, and truly a public servant. So thank you for keeping us safe and helping to educate me and hopefully a lot of others who will watch this today.
Thank you. And if I could add, I think it's really important that people remember we're trying to protect each other and our loved ones. Even if you're healthy, you may have an elderly relative or someone else that needs to be protected that you spend time around. So what we all do is important. So the hand hygiene we talked about, the masks, the social distancing, even as we open up, is going to become even more important to try to reduce transmission, and staying home if you're symptomatic. So thank you so much for the opportunity. I'm happy to do it anytime.
Thank you. Thank you, Dr. Lindsay. I'll see you in person one of these days, but for now, it's fun to see you on a screen.
It's great seeing you as well. Thanks.
Take care. Bye-bye.
Bye.